The flood of information coming out about COVID-19 right now can feel overwhelming. New Canadian cases are being reported every day. New rules and recommendations are being put into place to slow the spread of this coronavirus. And you, like us, have a lot of questions. So we're dedicating part of our program every night to answering them with a team of doctors. Tonight, we're joined by Dr. Samir Gupta, a respirologist and associate professor at the University of Toronto, and Dr. Samir Sinha, the director of geriatrics at Sinai Health System. Good evening to the both of you. Dr. Gupta, maybe we'll start our first question going over to you. How socially distant do I need to be? Should I stay home whenever possible?
So I think, if people are quarantined, then they're confined to their homes by definition. And what I would say now is that if you're not quarantined, you should act as though you are quarantined. So we really are encouraging people to stay home and avoid all contacts. And that means even contacts with family. Just stay with the people that are in your immediate home and don't expose yourself to anybody outside of that if you don't have to.
And what about something like taking the kids or the grandkids to a playground? Is that okay?
Not unless that playground is completely empty. And so, we contemplated that ourselves, but the reality is that if a few different people have that idea, then a few different people are there. So we're just not in a position where even that is a great idea right now.
Okay, Dr. Sinha, second question goes to you. If I'm returning home from travel abroad, when does self-isolation start? I mean, can you take a cab home?
Right. I mean, you have to find a way to get yourself home, and we're trying to say be smart about it. Try and get home as soon as possible. Don't go visit your friends, go out dancing, go grocery shopping. Get home as soon as possible. Try and do it in the way that minimizes the most contact. That might have to be a cab, and just make sure that other people could potentially do things like get your groceries. But remember, self-isolation, 14 days.
And Andrew, I'll add to that you may be returning from a foreign destination. You may feel like you're fine, but in the last few days in particular, we've now seen studies suggesting that many people will be able to transmit this pre-symptomatically, which means before they develop symptoms, and in some cases asymptomatically. So you may be able to spread this without even being sick. And so it's absolutely essential that you go straight home and don't make any stops and then start your self-isolation.
Okay, Dr. Gupta, this question goes to you. This is one we get an awful lot. What are the symptoms I should be watching for?
So unfortunately, the symptoms of this are really the same symptoms as you get with the common cold. So people will get sore throat, they might get a runny nose, fevers, body aches, they can get a cough. The sort of red flag, which indicates that it's gone onto the lungs and it's now become more serious, is if you get short of breath.
And if you have any of those symptoms, are you supposed to just assume that you have COVID-19 and sort of go into self-isolation?
Unfortunately, it's also flu season, and it's a time of year where people are still catching a lot of colds. So it's very hard to make that distinction. In an ideal world, I would say that you should get tested, but probably because we don't have enough test kits around, we're still limiting testing to people who have symptoms and who have traveled. So the answer is yes, you should self-isolate in case you do have this. And you should call the COVID helpline, and you should call your family doctor. Don't go to your family doctor's office, but call them and ask their advice.
Dr. Sinha, can this coronavirus stick to my jacket when I go outdoors?
Well, if you're not socially distancing yourself and your friend sneezes, for example, that's why we talk about 2 meters, that's 6 feet apart, because again, things can stick to surfaces. Hard surfaces are what the coronavirus likes more, and remember, hours to days is how long it can last, so it could technically last on your jacket, especially if you haven't spent enough time apart.
And are you supposed to then, disinfect your jacket every time you come home?
Well, again, within reason. But again, this is where we want to up our cleaning and making sure that if we do think that someone sneezed on our jacket or whatever, put it in the wash.
Okay, Dr. Gupta, I think we have one more question here, and it is, when will things get back to normal?
I wish I had the answer to that. All I can say is I don't think it's going to be days or weeks. I think it's going to be months, and I think whenever that normal comes, it'll be a new normal. I think we'll all probably be bearing some scars of this, and only time will tell.
Dr. Sinha, I hear that a lot, new normal. What's your take on this?
I absolutely agree. Right now, none of us have a crystal ball. We're just really hoping that if all Canadians can pitch in together, what your neighbors do and what you do, it counts, and we all have to stick in this together.
Dr. Sinha, Dr. Gupta, thanks for joining us tonight.
Thank you.
Thank you.
Now, as we mentioned, we will be asking your COVID-19 questions every night going forward, so send us any that you have. You can message us directly on Instagram at CBC The National, or send us an email at thenational@cbc.ca.